going to go over some diabetes information for you.
We're Advocacy partners. We provide services all year long. So our HHAP team can help you manage existing chronic diseases, find affordable health insurance, quit smoking, join walking groups, participate in peer support, connect to local health and social services. So today we're going to do a diabetes checklist. This is what we're going to be covering today. What is diabetes? Diabetes risk factors, taking care of your diabetes, monitoring your blood sugar, taking your medicine, and know your numbers, diabetes ABCs. So what is diabetes? So diabetes occurs when blood sugar levels are high because the body insulin or cannot use the insulin the way it should. If there is not enough insulin to attach to the sugar cannot get used for energy by your body.
This is a diagram of basically how the glucose in your blood comes from the food that you eat. And so right here we have the insulin. The first thing is the insulin lets the glucose into the cell. So the insulin in this, for instance, is the key. The glucose will be the white circle. Two is the glucose then goes into the cell to give energy. So once the insulin goes into the glucose then goes into the cell. And that's where you see the diagram. The orange is the cell and the insulin is the key and the glucose is the white circle. So insulin is a substance that helps sugar move from our blood into our cells for energy. So I'm gonna go over what are some of the risk factors for diabetes. So as it's listed here, high blood pressure can be one. High blood cholesterol is also another risk factor. Being overweight or obese could be a risk factor as well. Physical inactivity, stress, family history, and diabetes in pregnancy, which is also referred to as gestational diabetes. Blood sugar goals. So blood sugar targets for people without diabetes are consisted of these three things listed here. So less than 100 milligrams before breakfast is suggested, less than 110 milligrams before lunch and dinner, and then less than 140 milligrams or 2 hours after meals. For someone who does have diabetes, meals would be 80 to 130 milligrams before breakfast, and then less than 180 milligrams or 2 hours after meals. So these are some of the goals that you should look towards. Whether or not you do have diabetes, you should always measure your calories and look at the boxes, look at the nutrients on everything that you buy, and just try to track it as best as you can. It'll also help you to monitor your blood sugar. So what are some of the signs of high blood sugar, also known as hyperglycemia? So some of the causes are actually too much food, too little insulin or diabetes pills, illness or stress. So all of those can actually cause high blood sugar. And onset, meaning like how it would start. So it often starts slowly and may lead to a medical emergency if not treated. So like we always say, if you feel like any of these symptoms are too severe, definitely contact your physician or just go to the emergency room. So some of the symptoms are extreme thirst, having to urinate often, really dry skin, being hungry all the time. So that's kind of in connection with being obese or overweight, blurry vision, drowsiness, and slow healing wounds. So always check your feet in case that, you have any wounds. You want to make sure that your feet are always good, because a little wound could turn into something that is severe. So definitely always check to make sure that you're okay. So some of the things that you can do to combat this is just to check your blood glucose and also call your healthcare provider. Some more causes just continued: too much food, eating or little to no physical activity, not taking your diabetes medications if prescribed, illness, so if you're sick, and stress. What are some of the signs of low blood sugar, also known as hypoglycemia? So some of the causes of this are too little food or skipping meals, too much insulin or diabetes pills, and being more active than usual. Onset is often sudden and may pass out if untreated. So definitely want to pay attention to these symptoms. So some of the symptoms for that is being shaky, having a fast heartbeat, sweating, dizziness, feeling anxious, being hungry, blurred vision, weakness or just being tired, having a headache, and being irritable. So some of the ways that you can check this is, of course, by checking your blood glucose or treating, which would be by eating 3 to 4 glucose tablets or 3 to 5 hard candies that you can chew quickly. So such as peppermints, or drinking 4 ounces of fruit juice, or even a half a can of regular soda pop. So those are all ways to like boost your blood sugar level. And then you can also check your blood glucose again after about 15 minutes. And if it's still low, treat it again. So probably have another piece of candy or drink some more juice. And if symptoms don't stop, call your healthcare provider. So we always promote that. Definitely contact your healthcare provider if you feel like nothing is working for you and you're just confused about what's happening.
What causes hypoglycemia, which is also known as low blood sugar? So not eating enough, too much diabetes medication, too much exercise, and alcohol could cause low blood sugar. Yeah, so taking care of your diabetes includes healthy eating, being active, blood sugar testing, taking your medication, problem solving, reducing risk, and healthy coping. So as you can see on the other side, you see my healthy plate. We stress that a lot. Half of your plate vegetables, a quarter starch, and a quarter protein. That's a good way to control your diabetes. Go out for exercising. You see the man is taking his medication and the person here is checking their blood sugar.
One of the things that you want to make sure that you do is taking your medication as prescribed. Sometimes we'll take our medication and say, oh, I don't feel good today, so I'm gonna take medication. And then tomorrow when they're feeling better, they're not taking their medication. You have to take your medication as prescribed. If your doctor tells you to take it on a daily basis, in the mornings or after meals or before you eat, make sure that you take your medication as prescribed and routinely. Not only when you're not feeling well, because the medication is helping you to manage and maintain.
So make control of your goal. So this is things that you should do. You should discuss your A1C, your cholesterol, blood pressure, and weight goal with your health provider. So he or she will tell you what your A1C goal is, what your cholesterol goal is, what your blood pressure goal should be, and what your weight goal should be. Take medication as prescribed. Ask your healthcare provider which meds are to manage your diabetes. Know your diabetes meds and when to take them. Take your medications on time. Monitor your blood sugar. You should monitor your blood sugar how many times the doctor tells you to. So if he says 4 times a day, make sure you check your blood sugar 4 times a day. Diabetes ABCs. So the ABCs of diabetes, it stands for A1C, blood pressure, and cholesterol. So these are the ABC. So it has a goal of less than 7% for the A1C. Check every 3 to 6 months. So when you go to your doctor, they check your blood every 3 to 6 months, and they would tell you what your A1C goal numbers are. So it should be less than 7%. Your blood pressure, your goal should be less than 140/90. So, and your cholesterol, the LDL, which is your low density lipoproteins, that should be less than 100 milligram, and it's checked once a year. Also, you have dilated eye exam, which is done once a year to test for diabetes-related eye problems. Oral care, which is encouraged to take every 6 months. Foot care, screening done once a year by a health provider. Daily foot care should be checked at home daily. So you could check your foot to see if everything is okay, if there's any black spot at home every day. Your kidney health, screening test done once per year to check if diabetes is affecting the kidneys. Smoking, Take steps to quit smoking if you're smoking to prevent the spread of COVID-19 in NYC. So take these steps. Stay at home if you're sick. Only leave for essential medical care and testing or other essential errands. Wear a face covering. You can be contagious without symptoms. Protect those around you by wearing a face covering. Keep physical distance. Stay at least 6 feet away from other people. Keep your hands clean. Wash your hands often with soap and water or use hand sanitizer if soap and water are not available. Get tested. There are free COVID-19 testing sites in all 5 boroughs. To find a site, you could go to nyc.gov/COVID test or text COVID test to 855-48.
It's very important if you're a diabetic to take these steps to preventing COVID-19. If you're a diabetic and you catch this virus, your illness may be more severe than someone who doesn't have diabetes, right? You may end up on a ventilator in the hospital where someone else who got it, who's not, doesn't have any other chronic conditions, they may not. They may just be sick at home. But if you have diabetes, you can get severely ill with this virus. So it's very important that you use your mask and keep 6 feet away and stay home if you're sick and wash your hands, just as these 4 things say. For the latest information, you can always go to nyc.gov/coronavirus.
NYC hotline available free of charge to anyone experiencing problem with stress, depression, anxiety, or drug and alcohol use. Call 1-800-NYC-WELL or text WELL to 65173.